A fourth winter dose of COVID-19 vaccine has been recommended by the Australian Technical Advisory Group on Immunization for 4 at-risk groups. Adults aged 65 and over, First Nations Australians aged over 50, residents in aged care and disability settings, along with immunocompromised people over the age of 16 will be eligible, as reported by 9 News federal political reporter Chris O'Keefe. Minister for Health and Aged Care Greg Hunt confirmed winter doses will commence from April 4th, the same day the flu vaccine program will begin. Biden declares NATO will act if Russia uses chemical weapons. Greg Hunt said ATAGI has recommended a 4th winter dose of COVID-19 vaccine. Mr. Hunt said the 4th vaccine is recommended 4 to 6 months after the last booster. At this stage, the booster dose is only recommended for those 4 groups. It is only recommended for those groups at this point in time, Mr. Hunt said, explaining ATAGI looked at international evidence from countries such as Israel to make their determination. There is always room for review. At this stage, we're not predicting this is likely to change. Doses will be administered at pharmacies, GPS, as well as government-run vaccine hubs. Leaked document reveals Chinese military plans with Aussie neighbour. The 4th booster will be given out at pharmacies, GPS, and government-run vaccine hubs. O'Keefe earlier said ATAGI is concerned about rising cases and waning immunity from vaccine booster shots. As we get into winter, that 4th dose might be critical to the population to keep them out of hospital, O'Keefe told Today. The federal government is calling it the winter dose, and it will be given out to everybody over the age of 65, 4 months after their last booster shot. It comes as COVID-19 cases rise around the country, driven by the spread of the Omicron BA.2 subvariant. COVID-19 cases are increasing around the country as the Omicron BA.2 subvariant spreads. Infectious disease expert Professor Robert Bowie welcomes the news, saying it's critical to get booster doses when variants emerge. It becomes more important if the disease starts returning, especially if a variant happens, he said. For the moment, the immunosuppressed and the vulnerable are becoming into focus for the 4th dose. How Australia faced the emergence of the Omicron variant.